Patients always ask if they should perform their exercises pain-free, with a bit of pain, or the most they can tolerate. And the answer really depends. What are your long-term goals? What is your timeline for recovery? Does it need to be better faster, or can it take a little longer? How motivated is the individual and how much pain are we talking about? For example, a 2020 study published in the Journal of Orthopedic and Sports Physical Therapy by Hickey et al. Looked at acute hamstring strain recovery in groups working pain-free versus pain threshold rehab rehabilitation. The study had several goals. One was to see how quickly they were getting back to their sport. A second evaluation compared the strength of the knee flexors, muscle length, fear of movement, and re-injury at 6 months post-injury. 43 individuals were involved in the study, and there really was not a difference in return to sport. Both groups were back to playing within about 16 days. The difference was in strength upon their clearance to return. The pain threshold group was about 15% stronger. This group was still 15% stronger at the 2-month follow-up. There was a less than a centimeter difference in hamstring muscle length from baseline to the 2-month follow-up. Each group had 2 re-injuries. So this gets back to how you want to play the game. Both groups got back to their sport at about the same time. The group that pushed their rehabilitation harder gained more strength within the first 2 weeks and at the 2-month point than the group that performed all pain-free activities. When is the pain worth that extra 15%? For certain individuals in professional soccer careers, the 15% is pretty important. Taking a little longer to regain strength is not a big deal for the average adult or retired individual. Most people would prefer to feel more comfortable during their therapy than push for a little more strength. Most patients describe stopping all rehab exercises because of the pain they felt during a rehabilitation, which ultimately slowed down their improvement by doing nothing. Stopping all exercises because a few hurt is absolutely the wrong answer. We see people in the very early stages doing much better if they regularly perform their home exercises pain-free or with very mild discomfort. As a person progresses, they can challenge the tissue a little harder and experience mild pain as long as they are reasonable and are not risking flaring up their injury. The worst thing we can do is avoid all activity and movement, which will delay healing and create worse outcomes. Overdoing it right away and causing a greater injury on top of the first is probably the second worst thing you can do. So that leaves a large range between performing the exercises pain-free and performing them with some pain to tolerance. And I highly recommend performing the initial days of light range of motion and movement exercises in a pain-free manner, especially if the injury is severe. As you move further from the initial injury and have shown progress, start incorporating more discomfort into the activity as long as it is reasonable. As we return to full activity, the body can probably tolerate a greater challenge and some pain as long as we are not risking re-aggravating the initial injury. Most people overestimate their recovery and ability to participate in activity, leading to many flare-ups. It is usually better to go a little slower, prove you can, and then do a little bit more. This will get you back to activity on a safer path with fewer aggravations along the way.